Now on to the NSGEU. We are joined by Mr. Jason MacLean and Lynette Johnson.
Good afternoon, and thank you for having us here. I'm Jason MacLean, President of the Nova Scotia Government General Employees Union, and with me as well is our coordinator, Lynette Johnson. So as President of NSGEU and Vice President of the Nova Scotia Federation of Labor, I proudly represent thousands of people working in the continuing care sector. Many work in long-term care facilities throughout this province. And just as the DM said, the pandemic has exposed the weaknesses in the system. Interestingly enough, we actually represent none of the workers at the Northwood Halifax campus, but many of our members were forced to go to work there during the first wave of COVID, when the virus was ravaging through the facility. What happened at Northwood was a tragedy, no doubt, but it was preventable. To be clear, the staff at Northwood are not to blame for what happened there. I believe the government is. For years, they have ignored cries of workers in the unions who represent them, trying to call attention to the crisis in the sector, all the while cutting long-term care budgets. At the outset of this pandemic, we tried to raise critical concerns of frontline workers. Not only did the government ignore us, they accused us of fear-mongering and hyperbole. Then 53 people passed away. Systemic underfunding is the root cause of what was wrong with our long-term care sector. We have a government that has been fixated for 8 years on balancing their budget at any cost. Now we can clearly see the true cost of what that balanced budget was. In our report, Neglecting Northwood, we clearly outlined the systemic problems that came to light during COVID, including the fact that management for Northwood approached this government for 3 consecutive years, asking for funding to modernize their facility to make it safer for residents and staff. Those requests were denied. Make no mistake, what happened at Northwood could have happened at just about any long-term care facility in this province, and it still could. Because we still face systemic issues that have been raised by workers in this sector for a very long time. Band-aid solutions like providing bursaries, creating a new lower paid position in the sector, they're not going to solve the problem. In short, we need more trained and qualified staff to work in this sector. They need to want to work in this sector. The work that they do is hard work. It's physical, it's incredibly stressful, and it's certainly not glamorous. They make approximately $18 per hour for their efforts. In some communities, they need to work in multiple facilities to put together enough to make a living and support their families. In other areas, they are so understaffed that they cannot get vacation or time off approved. The sector needs to be completely reformed so we can actually keep people in this occupation. In many ways, government reaction to long-term care through the pandemic was simply indicative of how it views the sector in normal times. It is an afterthought. Our seniors and our workers deserve much better. Long-term care and home care must be thought of as part of our overall public health care system. Our government needs to take full responsibility for what happened at Northwood and invest in reforming this system. If they truly want to ensure Nova Scotians are protected, they will have to do that. Thank you for having us here today. I believe our members are the subject matter experts, and we're always available to share and to make this sector safer and enjoyable for all. Thank you.